Welcome to Learn Medical Spanish. In this video and podcast, I'm going to go over a pregnancy evaluation for a patient coming into the ER or urgent care. So probably similar, some overlap with if you were in OB-GYN or something like that, like a clinic, but certainly not all the same. All right, so as usual, I'm going to share the phrases in English first, give you time to think about the translation so you can see if you know how to say it or have some way to say it. And then I'll say it in Spanish, and then I'll let you repeat it a couple times. So I'll say it twice and let you repeat each time, in other words. All right, so let's get right into it. Here's the first phrase. Are you currently pregnant? So it's kind of just to confirm, right? So are you currently pregnant? ¿Está embarazada actualmente? ¿Está embarazada actualmente? How many weeks? ¿Cuántas semanas? ¿Cuántas semanas? By the way, that word actualmente probably throws a lot of people off because it sounds like actually, but that's not what it means in Spanish. It means currently. All right, next. When was the first day of your most recent period? ¿Cuándo fue el primer día de su último periodo? ¿Cuándo fue el primer día de su último periodo? So there's at least three ways to say period or menstruation, just like in English, right? Period, menstruation, other words maybe. But you've got periodo, menstruación, regla, which is more informal. So if you said something different, you might be right, in other words. All right, next phrase. Have you been pregnant before? ¿Ha estado embarazada antes? ¿Ha estado embarazada antes? How many times before this time? ¿Cuántas veces antes de esta? ¿Cuántas veces antes de esta? Quick reminder, if you see those phrases in parentheses, part of the phrase in parentheses, that's because you could probably leave that part out and the phrase could make sense. And you could maybe figure that out on your own, but I try to put that there as a cue. And some of the previous phrases had that. If you're just listening, sometimes you can shorten the phrase and it'll still make sense. And then if you're on YouTube, I kind of show you that sometimes with the parentheses. All right, next phrase. How many children do you have? ¿Cuántos hijos tiene? ¿Cuántos hijos tiene? This is, I'd say the majority of the time, it takes longer to say things in Spanish than English when you're translating. But this phrase is shorter in Spanish quite a bit. So just kind of worth noting, I guess. All right. So next is, we're talking about, what happened with all their previous pregnancies, right? So how many kids do you have? And then next we're going to ask, have you lost a pregnancy? Miscarriage? So we're just putting that word in parentheses, miscarriage, in case we need to prompt them if they don't know exactly what we mean the first time. Have you lost a pregnancy? Miscarriage? ¿Ha perdido un embarazo? ¿Mal parto? ¿Ha perdido un embarazo? ¿Mal parto? Have you had an abortion? ¿Ha tenido un aborto? ¿Ha tenido un aborto? So in that first phrase on this slide, when we say ha perdido un embarazo, that's kind of an informal way of saying it, right? Like, have you lost a pregnancy? A very formal way is the phrase aborto espontáneo. So if you want like a spontaneous abortion, but that's medical jargon at that point. So we're trying to mostly avoid medical jargon because they might not understand. All right, next phrase. Do you have abdominal pain? ¿Tiene dolor en el abdomen? ¿Tiene dolor en el abdomen? Nausea or vomiting? Náusea o vómitos? Náusea o vómitos? So that's a great example of the difference between English and Spanish pronunciation, because the word nausea is spelled the same in both languages, but you got to pronounce it correctly. So náusea is how you would sound that out. Do you have vaginal bleeding? ¿Tiene sangrado vaginal? ¿Tiene sangrado vaginal? Clots? Coágulos? Coágulos? And of course you could add more words, right? You could say with clots, or phrase it however you want. Con coágulos would be with clots. All right, next. Vaginal discharge. Flujo vaginal. Flujo vaginal. Clear, as in the vaginal discharge. Clear. Claro. Claro. Thick. Espeso. Espeso. What color? ¿De qué color? ¿De qué color? So you might not want all these details, but it's just if you did want to clarify some of the details about the discharge, if there were discharge. So there's a lot of phrases in the dialogue that are kind of optional to use. So you just kind of learn all of them and then use what you need. Next phrase. Do you know your blood type? ¿Sabe su tipo de sangre? ¿Sabe su tipo de sangre? Have you visited an OB for this pregnancy? ¿Ha visitado un obstetra para este embarazo? ¿Ha visitado un obstetra para este embarazo? What's your OB's name? ¿Cómo se llama su obstetra? ¿Cómo se llama su obstetra? Are you taking any medications? ¿Está tomando medicamentos? ¿Está tomando medicamentos? Prenatal vitamins? Vitaminas prenatales? Vitaminas prenatales? All right, now we're going to tell them about the plan. We've gotten enough information. We're going to order some tests in the ER. So what's the plan? So here we're going to say, we will do, ... We will do. Vamos a hacer. Vamos a hacer blood tests. Pruebas de sangre. Pruebas de sangre. A urine test. Una prueba de orina. Una prueba de orina. An ultrasound. Un ultrasonido. Un ultrasonido. I'll come back later to tell you about the results. Regreso más tarde para explicar los resultados. Regreso más tarde para explicar los resultados. So you may be thinking, why is that in the present tense when I say regreso? And that's because in Spanish, you can definitely use the present tense to talk about something that's going to happen pretty soon. So it does make sense, as in, I'm going to come back, regreso. Also, we changed the wording a little bit when I say like to explain, para explicar, and in the English when I said to tell you about. It means the same thing, but just in case that threw you off, there'd be other ways to say the same thing, basically. All right, so obviously when you come back and tell them about the results, there might be other phrases you'd want to use, like, you know, your results were good or bad, or you need to follow up with the OB or primary care or whatever, or I'm going to give you a medication. So some of those phrases are in another video that I have, which is about different medical specialists, but it also goes over kind of the discharge plan from the ER a little bit. So you can find that video on my channel, and I'll put a link below as well. So if you haven't already checked out my 5 beginner Spanish lessons via email, you can get those at learnmedicalspanish.org/lessons, and I'll put a link below. They're very high yield for ER providers, urgent care providers, that sort of thing. And if you're on YouTube, then check out my playlist here with a bunch more dialogues, some related to similar topics, usually related to people coming into the ER. There's also a bunch of anatomy and different things. But also you can see a playlist here with a lot of basic Spanish, really high-yield beginner Spanish. And if you're on the podcast, just scroll down and you'll find a lot of that stuff. All right, thanks for listening or watching, and I'll see you next time on Learn Medical Spanish.